Dr. Hossami, there's a lot of talk on the internet I found recently in regards to immunotherapy.
Yeah.
How long have you been doing that here for?
Immunotherapy in Verita Life has been for almost the past 5-6 years, has been being used. It's a little bit different than conventional immunotherapies. Conventional immunotherapy, mainly it's going also with pharmaceutical medications. But what we use in Verita Life here, it's more about biological immunotherapies.
Does that mean using your own body?
Exactly.
Okay.
So what we do is we harvest the blood or the immune cells from the patient. We send it to the lab, we extract the immune cells, multiply them, culture them, train them on cancer's antigen, and then give it back to the patient. It is in two forms. One is called the NK cell, which stands for the natural killer cell therapy. And these are cells which are responsible for more killing the cancers from the name, natural killer cells.
And so we have natural killer cells in our body
Exactly.
already.
Yes.
But you're extracting them and doing something with them in the lab to then put them back into the body.
Exactly.
To
And they're a
attack the
part
cancer.
of the lymphocytes,
Right.
which are the lymphocytes. These are the cells that are responsible always to recognize viruses and cancers and then attack them again. So when the cancers develop, sometimes, as we said previously, that cancers develop because of a weak immune system. So these cells might not be enough, or they might be weak to kill a cancer. So what we do is we train them and multiply them outside the body, and then we give it back to the patient. So usually, because they are the patient's own cells, so there is no side effects that can happen to the patient. And when we multiply them, we're giving back the patient billions of cells of the NK cells. So we have, let's say, a successful targeted treatment, and then without having any severe side effects.
And what is the difference between NK cell therapy and dendritic cell therapy?
Exactly. Dendritic cell therapy, these are extracted from monocytes, which is a part of our immune system. Dendritic cells, from the name called dendritics, that means they have dendrites, and it's like spikes, and under the microscope it looks like an octopus. All right. So what they do is these cells always search and look for cancers or viruses, and they attach into them, breaking them down. This breakdown releases always certain proteins which alerts the killer cells to be able to recognize the cancers and give it and start attacking the cancer again.
Yeah, fantastic. So it's great to know that there are no side effects with this type of treatment.
Exactly. Because it's the patient's own cells.
Yes.
So usually it might sometimes happen as a low-grade fever, as an immune reaction because of the high number of immune cells. But other than that, shouldn't be.
And how would a patient know that this is the right treatment for them?
Exactly. It always depends on case by case. Some patients, for example, which are extremely weak, or they are the immune system is extremely weak. So what we do is we build up the immune system, then we can harvest the cells again. Some patients which are early stages, or let's say as in dendritic cells, it can be used in very good cases for prevention or after remission, in order to prevent the cancer from coming back, training the immune system again, especially who went through conventional, for example, and then in conventional they say, all right, that's it, go home, we keep following up every year or every 6 months. So dendritic cells can be an option for them in order to train back the immune system and be able to prevent the cancer more from coming back again to the patient.
Fantastic.
So it's always taken case by case, who needs it, who's suitable for it, as what we do always in Verita Life.
Excellent. Thank you.
You're welcome.